Hey Doc or DC to be, welcome to our short promo video about the position. We are actively hiring an associate right now. Currently I'm alone with no associate, but we're looking very hard for one or even two associates. We are growing rapidly. We've been in the community of Redding, California here for over 25 years, and I want to say it's an absolutely wonderful place. What I thought of I was most proud of recently and during COVID, people really came together. We're probably the least fearful community. I've traveled all over the country for CBP seminars and personal growth and ChiroFest and everything else. And I'm telling you, this was like the least COVID paranoid and the most friendly community during that process of anything. We've got gorgeous lakes and rivers. We can go out, do mountain climbing and all sorts of super fun stuff around here. And we really believe in getting time to enjoy it outdoors, not working 50, 60-hour weeks. We don't believe in that because we believe in taking great care of our own bodies and being healthy ourselves. So more on that in a minute. So this is a great community. We love being here. It's a type of place where when you're at the store, you almost always see somebody you know and they connect. Hey, Dr. Todd, how you been? Whether I see him or whether I haven't seen him for a while, they're always telling me I'm doing my dental rolls if I haven't seen him for a while. And I personally love that. I love to live in a community like that that really feels like a community. And so as far as the position goes, it is full-time, but again, we're not really working full-time. We do cover your malpractice insurance, your health insurance, multiple benefits of that, a very competitive salary with actual potential for real bonus depending on production of the office. And if you have your own personal production, it involves definitely adjusting, definitely contributing to the clinical decision making of the office. We believe that you're here to take great care of patients, and I really want your insights into taking care of people. If you don't have any training in CBP, we'll get you the training. CBP is a critical piece of what we do, and more on that in just a moment. But if you don't have it, then that's no problem. We can get you trained in that both here in the office and at formal seminars. We really believe in CBP, but with a very innate chiropractic expressive touch and heart. And so the position is, again, available immediately. And any questions, you can always call me. Before I forget, I'll give you my cell number. It's 530-276-3311. If you have any questions about the position, and you'll be on the website if you're on this video, but it is chirofirstredding.net. Okay, so follow me. We're going to show you around the office a little bit to show you how we do CBP and how we integrate it. And so follow me. Take a follow. So we use X-ray a great deal doing CBP. X-rays are a critical piece to knowing what we do. You would be adjusting, taking X-rays. This is our X-ray facility right here. It does have room to do what we call correction potential X-rays, which means we actually put patients in the positions of correction to make sure that the traction that they're going to be doing all the work to do is going to actually make correction for them. We really believe in that. We love what Thomas Edison said: the doctor of the future will give no medication, but will instruct his patients in the care of the human frame, in diet, and in the cause and prevention of dis-ease. We put corrections up here as regularly as we can. We get a lot of great corrections. So this is our posture peak. This is where patients come in and do mirror image corrective exercises to warm up their spine, but also to actually correct their posture. We find that muscle work is absolutely critical to hold permanent correction. This is our power zone area here. Power zone is where we turn on the power. We make specific scientific principled chiropractic adjustments to release life into every cell, tissue, and organ in the body. So we do that here through mirror image drop, through toggle recoil, through diversified type, Gonstead type adjustments. We see patients very regularly because we want to get great correction and turn their power on. We do CBP, and it can be a mechanistic technique, but we really believe in the innate chiropractic philosophy in above, down, inside, out, and in releasing life through the power of the specific adjustment. Then once they get adjusted, continue following. We have information for patients for referrals and to give them info on how to change lives with other folks. And this is welcome to Thoracic Park. This is where we do all our traction. This is Hannah, the queen of traction, or the queen of torture, as some call her. So we do a specific correction through. There's thousands and thousands of different traction setups. We use very thorough CBP protocols through dinner roll tables, through seated, through Myers traction, through posture traction, through lateral translations and tractions on the Berry table, compression extension. We use winches for patients who are heavier. They have control over their own lumbar traction. We do everything that a patient needs to get them well, to do the best care anywhere in the world. So we believe what B.J. Palmer said is that the medical doctor has the practice, the preacher has the principle, but only the chiropractor has the practice and the principle. So we have to have excellence in right hand, which means we love well, we care very, very deeply for our patients, and we connect with them as human beings. We also have to have the other hand, that we use excellent, specific care that actually leads to some permanent correction and permanent life changes. So again, if you have any questions, reach out through email, drtodd@chirofirst.net, or call me on my cellular at the office here, and we look forward to meeting with you and seeing if this is a win-win.